How is your doctor able to tell you how much longer you have to live when you get like a cancer diagnosis or when to come back for a follow-up appointment after a heart attack? The answer is in a centuries-old mathematical idea known as Markov's chains. This idea is what is used in healthcare for doctors to be able to give you a prediction on how much longer you have to live or even just plan out the number of beds that they may need in a hospital or the number of staff that they may need available for patients that they see. And the concept of Markov's chains is very simple. And the idea around it is a lot of the decisions that we make are not dependent on what happened before, but really only on the immediate decisions that you make at the time of trying to predict the future. So using this idea means that we go into this memoryless. For example, it doesn't matter if you're 40 or 50 years old, but if you get diagnosed with a certain stage of cancer now, then your doctor is able to tell you how much longer you have based off of that immediate information and not based off of how much longer you have lived or all the lifestyle choices that you did before that. The idea in itself is pretty simple but very counterintuitive because you would think that a lot of the decisions that we make in the past will affect future outcomes, but this concept sort of negates all of that. Now, let's look at cancer, which is a pretty good example, and why doctors usually are able to give you almost accurate representation of how much time you will have if you get diagnosed with a certain type or stage of cancer. Cancer is a journey with movements between very clearly defined health states over time. Each state has chances of moving into another state within the next month or the next quarter. And death is the final state of that journey, which means that once you enter death, then there is really no journey anymore. The cancer journey can be broken down into steps, such as the first step being where you're healthy and there is no evidence of the disease. And another state is where you have progressed with the disease and are not really responding to treatment that well. And the final state is death. Every time you see your doctor or you go into a hospital, what they're doing is trying to monitor which of the states you're currently in. And that's because the next step that you go in is going to be very heavily dependent on the current state with which you come into the hospital or the state with which your doctor sees you at that time. And so, because your doctor is seeing you and maybe hundreds of other patients like you, they're really able to give some sort of a probability with a high degree of certainty of what state you're going into based off of all of that information that they're getting. They can also make certain adjustments with deciding the next state that you go into based off of things like your age or the performance of certain biomarkers or just in general how your body is responding to treatment. But really, those don't really move the probability that much. And so, based off of that information, your doctor is able to give you numbers like you have 6, 12, 24 more months to live and things like that. And you may be wondering, well, if we have all this information and can confidently give people timelines on how long they have to live, why do some people beat the odds? And so the reason why some people beat this odds is because doctors rely on giving you these numbers based off of the information that they're getting from large numbers of patients with similar cancers or similar healthcare conditions like yours. And what this model gives is an average, not necessarily a precise time or date. So, for example, when your doctor says you have 2 years to live, what that means is on average, a certain percentage of people like you within that specific type and stage of cancer have lived for 2 years after a diagnosis. It does not exactly predict that you, in your specific case, will have 2 years. You could have two, you could have four, you could have 10 and be an outlier in this case. Another reason why a lot of people could beat this odds is because a lot of the information that is used to compare you to could be from patients with older data or patients that had died a longer time before you. So it will not take into account if you're enrolled into some cutting edge clinical trial that just gives you better odds. And so doctors really avoid giving people exact dates and mostly just rely on giving ranges, which could be in the form of months or years. Another way that we see this mathematical concept unfold is with hospital capacity planning. And usually that's how hospitals are able to sort of prepare on how to better serve the patients that come into that hospital or in that community that the hospital is located in. For example, if we run a cardiac center or a cardiac hospital and we get about 1,000 patients that come in a year, then, using this concept, the hospital is able to predict which percentage of these patients will be hospitalized, those that would be in the ICU, and those that may need specialty care from a cardiologist. Let's look into how they try to model this situation out. If you run a hospital and you get about 50 patients that come in a day, you'll categorize these patients into a few buckets. The first will be patients that are coming in unattended. So relatively healthier patients with heart conditions, so they don't have a heart attack or a stroke. Another category may be patients that have heart attack and are in active need of specialty care. Using this information, the hospital is then able to categorize all of these patients into tiers of who is the most in need of medical attention and who can be seen by the doctor in a day or two. And this is the concept that is used by hospitals to triage patients. And it's probably the reason why it's so hard for you to see your doctor, because you may be having a mild heart attack and there's somebody who has a much more serious problem than you. Heart attacks are really just one of the examples here, but it explains the whole concept of how hospitals choose to prioritize which patients to see when they tell you to come in to see a doctor, and why it can sometimes feel so impossible to get a doctor's appointment when you think you need it. The hospital is using this mathematical equation, looking at your medical histories and deciding on which patients are the most in need of healthcare. And even though it may not always feel like it's fair to you, the goal is hospitals need to prioritize to see the patients that are more sick than you. And I would say if you're having a hard time meeting a doctor, it should be a good thing to you, because what that means is you're probably just not sick enough to get that appointment.